All right, let's jump right in. We're about to tackle a story about one of the world's biggest healthcare challenges, happening in one of the most populated countries on Earth. And the solution we're looking at? It's not just about more doctors or building more hospitals. It's artificial intelligence. And it's not some far-off future concept. It's already on the ground, changing and, yes, saving lives all across India. To really get a handle on the problem, you have to understand the scale we're talking about. Just look at this picture. This is the Mahakumbh Mela, a festival that draws in over 500 million people. Now, just try to imagine running a public health system for a population this huge, this dense. It is a logistical mountain to climb, not just during festivals, but every single day. So that leads us to the big question, right? In a country with over 1 billion people, where so many live in remote or underserved areas, how do you actually deliver top-notch medical diagnostics to everyone? How can technology possibly bridge a gap that massive? Well, that's exactly what we're going to break down. To find the answer, we've got to face some pretty tough numbers first. Let's really dig into the sheer scale of India's diagnostic challenge. Okay, let's start with tuberculosis, or TB. Every single year, India sees about 2.7 million new cases. And that's not just a big number, that's more than a quarter of all new TB cases on the entire planet. It's staggering. And the human cost here is just immense. Over 320,000 people die from what is, remember, a treatable disease. And so many of these deaths happen in places with limited access to care where help just arrives too late. So you have to ask, why does this happen? Well, it's not just about the disease itself. The real issue is a bottleneck in the system. There's a critical shortage of specialist doctors, and most of them work in the big cities. This leaves huge parts of the country, especially rural areas, facing massive delays in getting a diagnosis, and those delays can be fatal. But what if you could change that? What if you could give every doctor, even one in the most remote clinic, an expert assistant, an AI co-pilot, basically, that gives them a second opinion not in days or weeks, but in seconds? And this right here, this visualizes the incredible leap we're talking about. On the left, you've got the old way, a doctor literally taking a picture of an X-ray film with a phone, trying to get a consult. On the right, that's the new reality. The same X-ray, but it's been instantly analyzed by an AI with all the potential problems highlighted. It's a total game changer, from slow and manual to instant and automated. So the technology behind this is a tool called QXR. You can think of it as a highly trained AI that does one thing incredibly well. It reads chest X-rays, but it's unbelievably fast and powerful. In just a few seconds, it can scan for more than 30 different problems, spotting everything from the classic signs of TB to the tiniest, most subtle nodules that could be early signs of lung cancer. All right, so that's the tech in theory, but what does it actually look like when you put it to work on the ground? Let's check out how this AI is making a real-world impact from India's biggest megacities to its most remote villages. First, let's head to Mumbai. Dr. Mangala Gomare, a top health official, just nails it. The AI gives them an answer in 3 minutes. That kind of speed means they can spot potential TB cases almost instantly and get those patients fast-tracked for more tests and treatment, no time wasted. Now get this, because this is one of the most amazing parts of the story. 35% of the TB cases they found using this AI were in people who came to the hospital for something completely different. A routine checkup, a minor cough. The AI spotted something that everyone else might have missed. It's finding a hidden disease in people who didn't even know they were sick. Now, let's go from the urban sprawl of Mumbai to remote tribal communities. Here, the biggest challenge isn't just the lack of specialists, it's sheer distance. The solution? It's brilliant. Put the X-ray machine and the AI in a van. These X-ray on Wheels programs are literally taking the hospital's diagnostic power out on the road, directly to the people who need it most. And the impact this has is it's night and day. Before this, getting a diagnosis could take a month and a half. Think about that. You get an X-ray, then you wait and wait for it to be sent somewhere, read, and for the results to finally come back. With AI in that van, the turnaround time is crushed to less than a week. For a patient, that's a life-changing difference. And this technology isn't just for TB. In Punjab, it's being deployed for one of the most time-critical emergencies you can have, a stroke. They've built this clever hub-and-spoke network. Smaller local hospitals are the spokes, and the main specialist center is the hub. The AI is the connection that makes it all work instantly. When you suspect a stroke, every single minute is precious. This chart shows how AI is literally buying patients time, and lots of it. By analyzing head CT scans in under 3 minutes at those smaller hospitals and instantly alerting the specialists at the main hub, they've cut the diagnostic time by an unbelievable 85%. That's not just making things more efficient, it's the difference between a full recovery and a permanent disability. All this data, all these statistics, they're powerful. But to really, truly understand the impact of this technology, you have to look beyond the numbers and see how it affects a single person. Because at the end of the day, this is about individual lives. And as Dr. Prince Franco puts it so perfectly, when you're dealing with something like lung cancer, everything, absolutely everything, comes down to catching it early. So I want you to meet Joby. He's 39 years old, a truck driver. He's not a smoker, has no family history of cancer. He just had a cough that wouldn't go away. By all the usual checklists, he was not someone you'd consider high risk for lung cancer. He went in for a routine chest x-ray, and that's when it happened. The QXR software flagged a tiny, suspicious-looking nodule. His doctor saw the alert and followed up immediately. The diagnosis? Stage 4 lung cancer. Because the AI caught it, they confirmed it within a week of that first x-ray, giving Joby a crucial head start on his fight. It was a discovery that, honestly, might never have happened otherwise. Joby's story really shows you the incredible potential here. So let's zoom back out and look at the big picture. Because this isn't just a promising pilot program anymore. This is healthcare being totally reimagined, validated, and ready to scale. And this is absolutely key. This technology has been put through the ringer. India's official health technology assessment body studied it, and their conclusion was crystal clear. It's not only better at finding TB, it actually saves the healthcare system money. They have officially recommended it for use across the entire country. That's the official green light. And the ambition here doesn't stop at India's borders. The whole vision is to take this proven, life-saving technology, a technology that was built to solve India's unique challenges, and bring it to the rest of the world. It's about using this powerful tool to help fight these diseases everywhere. And that leaves us with one final powerful thought to chew on. A chest x-ray is one of the most common medical scans in the world. There are millions and millions of them taken every single day. We just heard the story of one of them, Joby's, that made all the difference. So what if every single one of those routine scans in every clinic and a hospital, everywhere in the world, had a second set of AI eyes looking for the unexpected? What if every x-ray held the potential to save a life?